this is just here to make me seem intelligent. I really don't know how to do this, but I'm playing with it anyway. Hi everyone, thanks for joining me today. It's 5:45, so it's probably the most perfect time to join me while I review some YouTube videos, because after a long day of being a restorative clinician, I think I've heard it all today, day of consults. And the YouTube video that I picked up today is titled, "I cannot feel the left side of my face, root canal." So it sounds like one of those horror stories that patients end up reading or viewing, and I have to give my opinion on, or I have to defend the profession based on a YouTube review of a root canal. But needless to say, let's just see what this reviewer says, because I'm sure a lot of the clinicians, both dentists and non-dentists, who would have seen this, definitely experienced patients who went through this process, like hi, Google, and all of that. So I thought, what exactly is Google saying? And yeah. So that's what the lady has to say.
If you've been following my vlogs over the past maybe month or so, maybe even longer, I've been talking about getting a root canal done.
So she says that she's been waiting for about a month, if not longer, to get a root canal. And for me, that's concerning, because why do you need to get a root canal? And it's because there's been an infection, or you've had tooth decay that's gone into the nerve, and waiting for a month before you get the root canal done is kind of neglectful, because you're waiting for a problem to happen unforeseen. And that's when, yeah, the metaphorical shit goes down. Needless to say, she waited for a month, and as we'll hear her speaking later on, she goes on to say about she phoned around different dental practices for price of a root canal, and then she checked with her insurance on that there. Money is always a contentious topic, and whether you're speaking from a position of privilege up or privilege down, money is a factor that we all have to consider. However, phoning around for a cost of treatment is not what you should be doing. It doesn't work like that, because the first clinician, he had the opportunity of examining you, and the rest of them are just giving you a cost over the phone. And there's so many factors at play. A root canal is not just a root canal. It's a front tooth versus a back tooth, or an anterior tooth versus a posterior tooth. It's a molar tooth that could have 3 canals or 4 canals, all of which affect the price of it. So this review is already looking a bit dodgy for me, and it does tend to echo the thoughts and feelings and emotions of many patients. But I think we just need to narrow things down, that when you've gone to someone who's trained in diagnosing the need for a root canal, and you wait for a month before acting upon it, you are looking for a bit of trouble.
A referral, I got an x-ray, all that fun stuff. Now, I had ended up calling yesterday to get a price on a root canal, and it was gonna be kind of expensive. It was, even with my insurance, you know, obviously it doesn't cover all of it. So I was just like, oh, do I really want to pay that to save this back tooth? So I just kept kind of going over in my head, like, do I want to save it? Do I want to save it? Not really. I really don't want to save it. It's, again, the tooth, if I still had my wisdom tooth, it would be the one right next to it on my bottom jaw. I didn't really care. Like, no, I wouldn't see it when I smiled. Like, it's just, to me, less brushing. Which is an awful way to look at it, but that's just me. I try to avoid anything medical at all costs.
So her next justification is saying that she wanted to avoid looking at getting the root canal because it's her second molar, and it's not there when she doesn't see it when she smiles, and she laughs it off as saying it's less brushing. So it probably, in all intensive purposes, less brushing, but she hasn't extracted the tooth, so she still has an infected tooth in her mouth. So while she has a tooth to brush, there's an infection that's brewing in there. The other thing that she says that yes, cost is a factor, and it's not in her smile and less brushing, but then she says she doesn't want to have any medical thing done. I'm not too sure about that, because when you have a headache, you take a paracetamol, or when you have an asthma attack, you're taking an asthma pump. Doesn't mean that you don't like to have anything medical. I think you shouldn't be having anything done electively, yes, but if there's a need for a root canal, you should have it done, and you shouldn't be delaying it. And also, less brushing, I'm sure a 65-year-old version of her who's missing a lot more teeth would probably regret her for saying that. So maybe we should be trying to keep our teeth rather than thinking of it as less brushing.
So I ended up calling the root canal people, getting a price with my insurance and everything, and I had gone to work that day. Now this was yesterday. I was in excruciating pain. I mean, the most pain that I've been.
So there we go. Our another problem that pops up here. She did the responsible thing, and yes, I'm not refuting that she shouldn't be looking around for price. Yes, all of us are consumers and we all are facing tough economic times, but there's a limit. So she waited up until there was excruciating amount of pain. Now we are putting ourselves, or now she's put herself in a position of duress where she has to accept treatment from anyone at any time because she's in pain. Again, a situation that could have been avoided, but she's and I think this probably also echoes the thoughts of why so many patients again feel that root canals are this traumatic, painful experience, because I think you build yourself up trying to psych yourself into getting it done and you never get it done because we procrastinate most things. And then when you actually do need to get it done, there's a full-blown infection and excruciating pain, and seeking help at that time is never a pleasant experience.
Been in with this tooth by far, and that's what like pushed me to call. So I went to work that morning. I was still in a ton of pain, but I was using clove oil, I was using hydrogen peroxide rinses, saltwater rinses.
She was using clove oil, hydrogen peroxide, rinses, saltwater rinses, none of which are researched analgesics, none of which are researched antibiotics, none of which have shown any proven efficiency over long-term studies to eradicate dental infections in any level. So again, if you are seeking help or you are in the position of needing help, then you need to be following the correct protocols. By no means am I refuting the need of homeopathic medication or alternative natural medication, but I think in this type of situation, you need treatment, whether it is an extraction or a root canal, but you actually do need treatment.
Ice, heat, everything I could to make the pain kind of go away, and it's been like tolerable since then. This morning I'm a little bit sore, like the pain is still definitely there in my jaw, but the problem is now the pain is shooting up to my ear.
I don't want to be judgmental, but she has nails that look long and expensive, and she's shopping around for the price of a root canal for the last month, but she's obviously had time to do her makeup and nails, and I think priorities also need to be looked into as well. I think it's not something that we like to say or that we should be saying too often, but you're in pain, you're shopping around for the price of cheaper healthcare, but there's a lot of other things that are being spent on, and yeah, perspective needs to also prevail at some time.
As well. So I'm just like overall really uncomfortable in my face. I went to work that day and I was talking about my coworker about the price that it was going to cost me, and they're like, well, do you want to save it? Do you want to get a root canal or an extraction? Because an extraction is going to cost you a lot less. And I told them, I'm like, honestly, I don't really care about losing this tooth. I just want it gone. So they gave me a referral not a referral, but they recommended me to a dentist. So I called the dentist, asked them the difference between what an extraction versus a root canal would cost for them, and it was like significantly different. So I'm like, well, the option is clear to me, like to save my family some money, I'm just gonna have this thing pulled. So I end up setting up an appointment with this dentist for an extraction. TJ gets out of work early because I was going to be on a local anesthetic, so I needed, help to get around and pick up Ella and all that stuff. So I leave work early. I lost hours at work. He leaves work to help me out, and we get to the dentist. We have to wait about an hour. And granted, I got there like 20 minutes late, but I did call them and I'm like, I'm so sorry, we're on our way.
So let's touch on this topic. She took time off work because she didn't plan. She waited for the pain to become excruciating, and now indirectly I'm picking up this tone of her complaining of the inconvenience of going for this root canal or going for this extraction. But she could have planned it for Saturday or after hours or during work, but she waited for the pain to kick in. And now she talks about initially about waiting for an hour before being seen to. And then as a side note, granted I got there 20 minutes late. Like, the dentist obviously had other patients to see. or another emergency may have walked in, and she was late for an appointment, but she was never going to say, I'll be late, I'll be there in 20 minutes, or I'll be there in 15 minutes, because traffic happens, life happens. So I think it's a little bit of giving the dentist a short end of the stick, to say that she had to wait for an hour as the first message about her visit.
We get there finally, the doctor takes us in, and they're basically just talking to us, and I didn't really like the place. I didn't really feel comfortable even first going in. Long story short, he basically told me that they weren't prepared that if I was having a reaction to the anesthesia to like wake me up. So they referred me to, they said I need to go to an oral surgeon. So, damn it, I've gone through this entire process to have my tooth pulled. I was so upset because I thought I was gonna have the problem taken care of right then.
So now she talks about not liking the dental practice, and I think this is something that Fahima and I spoke about quite extensively when we looked at opening a practice and trying to set up a practice and what type of practice environment we wanted. Because as much as it's all about dentistry, it's all about having this environment that's technologically advanced and you have state-of-the-art equipment and materials that makes us work in a pleasurable environment. I think it's really important that patients have an experience that makes them feel comfortable, because similar to her, we can't plan on what type of patient or what profile of patient or what circumstance a patient is going to come from when they enter the practice. But I think once they're there, our passion is to help, is to fix, alleviate of pain, restore, rehabilitate, whatever it may be. And I think that's where I think Matrix Dental felt like perfect. Because it's home. We try to create this home-like environment. We try to make this environment that's welcoming and just create one less variable of stress for patients to go through. But yeah, I just realized that my hair looks like shit. It's a COVID hair, everybody understands. Needless to say, she's laughing at the fact that she couldn't have a tooth extracted, but it's her fault. She was late for the appointment. She went to a dentist that she hasn't been to previously. She gave him her medical history now, and he's probably done the safest thing anyone that has treated her has done for her, not treated her. It's responsible. So unfortunately, once again, this whole process of root canal and the stress of the root canal just gets heightened because pain, cost, delay, shop around, delay, ask friends for opinion, and eventually decide on getting treatment done. And perhaps the initial dentist could have just suggested the root canal for her because he probably thought it was maybe the safer option to do, as opposed to putting her at the anesthetic risk than what she's currently decided on. So maybe it wasn't a money decision, maybe it wasn't a dentist doing what he wants to do. Maybe it was just for her best interest to have a root canal done because the anesthetic sounds like it was very different. Yeah, the light bulb just came on for me. Yeah.
More than the root canal just for an extraction.
So, funny enough, she gets referred to get the tooth extracted, and now the extraction works out to be $100 more expensive than what the root canal was. So perhaps the initial dentist wasn't just a capitalist trying to make money off her. Maybe he was just doing what was best for her financially by offering the root canal, because in all likelihood he was aware of her medical history. And maybe he was also doing what was more financially viable. So yeah, I think maybe we need to treat dentists with a little bit more mercy than thinking that they're just out to make money all the time, because there are some guys, like in this case, who was actually doing what was best for her. I think we'll leave it at that for today. We're pretty much 5 minutes into this already, and it's been a long day for all of us. So let's see what happens next week. Did she actually go for the extractions? Like, I always wanted to have a cliffhanger ending, and I have it in my first video. It's cool. So let's see what happens next week. Does she get the root canal done, or does she go forward and have this extraction done for $100 more? Thanks for tuning in. Cheers.